Cardiologist has said within the last hour that James has been discharged from the hospital and is now resting at home. That's good news. 18-year-old Bronny James is an incoming freshman for the University of Southern California men's basketball team. A family spokesperson said in a statement that Bronny was hospitalized and was in stable condition on Tuesday and had been taken out of intensive care unit at that point. Two key cardiac screenings he had recently both had come back normal. Dr. Talha Farid is a St. Luke's heart care cardiologist joining us in the studio. We want to thank you for joining us. I think a lot of people don't quite understand heart attack and cardiac arrest. What is a cardiac arrest?
So cardiac arrest essentially is an electrical problem. That essentially means that heart completely stops beating. And as a result, there's a lack of blood supply to the brain. There's lack of blood supply to the other vital organs. It can make you pass out, unconscious, and can result in death if not treated. Much different than a heart attack. Heart attack is a different issue. Heart attack is actually a plumbing problem. That means that there's a lack of blood supply to the heart. So there's a blockage of heart artery that results in lack of blood supply to the heart, that results in death of cardiac muscles or the heart muscle. That can cause chest pain, shortness of breath, arm pain. Now, the heart attack can result in cardiac arrest or sudden cardiac death, but they are different.
But when you think of a young 18-year-old, a healthy athlete, a heart attack obviously would seem so unusual because, as you said, it's a problem with the plumbing. The cardiac arrest makes a little bit more sense because it is sudden, it's undiagnosed, and it has nothing to do really with the health of the person.
No, you're absolutely right. I mean, when we think of causes of sudden cardiac death, they're very different based on the age of the population. So in older people, heart attack is the most important cause of sudden cardiac death. That's not the case in younger population. Somebody like him is going to be congenital heart diseases, something that you're born with, thick heart muscles, some electrical abnormalities. So that's the thing that you worry about in younger population, which is completely different.
Ask any parent. I mean, when you just hear what I had said, was that he had had 2 heart tests, everything seemed to be normal. Any parent is sitting there going, how can I tell? How can you at all be able to diagnose your child?
Sometime it can happen without any warning signs. So unfortunately, sometime the cardiac death or something like that would happen is the initial presentation, so you wouldn't know. There are other times when there are some warning signs and somebody is all of a sudden feeling lightheaded or tend to pass out or passing out without any warning signs, then you should pay attention. But unfortunately, there are other times when you just cannot tell.
But let's be honest, I mean, these athletes are always around trainers, around coaches. We have seen it time and again where before the first responders come, somebody's there to help them.
Right.
You want everyone to have someone nearby to help them.
That's right. The most important thing that you can do is learn to do CPR, and I think all of us should know that. It can really save a life. The most important thing is if you can do a proper CPR till the help gets there, till the medical staff gets there, you can really save a life.
Because let's be honest, every second, I know it's a cliche, but in so many different ways, every second does count.
Every second counts. When we talk about heart attack, we say minute is muscle. Same thing here. I mean, every passing minute counts, every second counts.
And we were also talking a little bit earlier about the cause. Is this always a genetic issue?
Younger population, it's mostly genetic. There are certain diseases that we don't know the genetics of, but it's mostly genetic.
All right. We appreciate you, Dr. Farid,
who
is a St. Luke's heart care cardiologist. Thank you so much for joining us.
Thank you. Thanks for having me.